There are four primary things that you should look at that affect the cost of your procedure. First is, does the provider have a flat fee system or a prescription-based system? Meaning, when you see those $4.99 ads, those are for very mild prescriptions, which only 2% of the population qualifies for. Reason number two that affects cost has to do with how the flap, the first step in LASIK, is done. There's an older surgical device called a microkeratome, and that is a less expensive way of flap creation. And the more advanced way, in the way that we prefer to do things at 2020 Institute, is using a laser to fashion that flap. Of course, that is more expensive than the older mechanical device to create the flap. Next is the laser used to reshape your cornea, or in essence, take away your eyeglass prescription. The older 90s lasers that did standard LASIK technology or reshaping are less expensive than the lasers that are used now in the advanced form of LASIK called wavefront or custom LASIK. And then you want to know long-term, if something down the road were to happen to your vision, what kind of refinement policy does this provider offer? Do they have a no-charge refinement option for you where if in 10 or 15 years your vision would change, could you come back at no fee and have a refinement or a touch-up to restore your vision again? So all four of those things add to the compilation of the final fee, and it's important you select the options that you're most comfortable with.